Platelet-rich plasma, or PRP, is basically taking the body's natural healing mechanism and using it to our advantage to treat musculoskeletal conditions throughout the body. We take the blood from the arm via normal blood draw like you would have in a lab, and then we take that blood and we centrifuge it down in a machine that layers out the cells of the blood. We take those platelets along with a little bit of plasma, and we use that via an injection to treat various musculoskeletal conditions in the body. Platelets are what stimulate and regulate the natural healing phases of the body. So if we take the platelets and we inject them into soft tissue or into a joint, it will stimulate and regulate the healing phases locally to help improve the pain, inflammation, swelling, etc. of that tissue or joint, and then help with the patient's pain and function as a result. So PRP can be used for a variety of conditions. Some of the more common conditions that we use it for is tendinitis. Tendinitis or tendinosis is a painful condition at a tendon in the body. Common tendinitis examples would include golfer's elbow, tennis elbow, patellar tendinitis at the knee, which is runner's knee, also Achilles tendinitis at the ankle. These are all painful conditions of the tendon. And what we can do with platelets is inject the platelets directly into the tendon, and platelets will then stimulate the healing response within the tendon, and that, along with physical therapy following the PRP injection, can really help with the health of the tendon and the architecture of the tendon to make it non-painful for the patient. Another condition that we commonly use it for is osteoarthritis of the joints. Any joint in the body is susceptible to having osteoarthritis. It's a wear and tear condition of the cartilage. And as we age and are active, our cartilage starts to break down, no different than tread on your tires. And we take platelets and we inject them into joints via PRP. And platelets then release growth factors and cell signaling molecules that have a robust ability to decrease pain and inflammation and swelling within the joint. And they do this over the course of several weeks, and then as the weeks go by, the patient typically will notice a significant improvement in their joint pain, swelling, stiffness, etc. And this then allows them to get back to the activities they love pain-free. Additionally, platelet-rich plasma can be used for ligament and/or muscle injuries. In summary, platelet-rich plasma really can be used throughout the body for various musculoskeletal conditions, and is a really nice, natural way to try to help with pain, inflammation, swelling of the body's joints and tendons and ligaments, etc., to help improve the quality of life and allow patients to get back to the things they love pain-free. So prior to a platelet-rich plasma injection, it is very important that patients avoid anti-inflammatory medicines like ibuprofen, Aleve, naproxen, etc., for 1 week ahead of the injection. The reason for this is that anti-inflammatory medicines deactivate platelet function, and we obviously do not want to be doing a platelet-rich plasma injection with a bunch of unactivated platelets. Secondly, patients need to be prepared that the injection may make their pain a little worse for the week or two after the injection before it starts to make it feel better. The reason for this is that the first phase of healing in the body is inflammatory. So when we inject the platelets, it is very common that you will have an inflammatory response in the initial week or so after the injection, and that can make the pain and symptoms worse temporarily during that time. After the platelet-rich plasma injection is complete, most tendon, ligament, and muscle injuries really do require good physical therapy. We want to make sure we're strengthening the structures over the course of the weeks after the PRP injection and avoiding the things that exacerbate the symptoms in general so that the tissues have a good chance to heal. Whereas with osteoarthritis, physical therapy still can have a role to help with range of motion and swelling, but it's not as essential as it is following a tendon, ligament, or muscle injection. And after the platelet-rich plasma injection, it is very important to continue to avoid the anti-inflammatory medications for at least 48 hours after the injection. Ideally, if you can avoid anti-inflammatories for 4 to 6 weeks after the PRP injection, it is best.